Hi, everyone. I think we're starting. Welcome to our session, Live Well at Work, Creating a Culture of Health. I'll just have everyone introduce themselves. My name is Amelia Barile-Simon. I'm a community health promotion specialist too at the County of San Diego. I work under public health services in the chronic disease health equity branch. And then we have 3 speakers today. So Spencer, you can go ahead and introduce yourself.
Hi, my name is Spencer Stein. I work with Amelia at Live Well at Work, which is under the Chronic Disease and Health Equity Unit. I'm a health equity specialist, and we're excited to share about how to create a culture of health today.
Good afternoon, everyone. My name is John Haubenstricker. I'm the wellness coordinator for the American Red Cross WIC program, and I'm excited to share some of the tidbits of our successes with our program and hopefully have a few tips that you can take away for yourselves.
Okay. So let me see if I can advance my slides. Are my slides advancing, you guys?
No.
No. Oop, I see, I have to roll it. Okay.
Great. So let's begin. So chronic diseases are among the most prevalent and costly health conditions in the United States. Nearly half of all Americans suffer from at least one chronic disease. And so the Live Well San Diego vision was adopted at the County of San Diego Board of Supervisors in 2010 and includes 3 components: building better health, living safely, and thriving. And the mission of the Chronic Disease and Health Equity Unit is to promote wellness and prevent illness, disability, and premature death from chronic disease by increasing health equity. So Live Well at Work was born to develop, to help San Diego organizations, especially those that are less resourced, build better health, live safely, and thrive. And that's by promoting health and making organizational-wide changes at the work site. Next slide. So since there are over 1.5 million workers who spend at least 8 hours a day, a third of their time at work, the workplace is an excellent place to provide programs, education, and opportunities for individuals to move in the direction of wellness. And in San Diego, these health issues are associated with an estimated of $4.6 billion in direct healthcare costs. And for many businesses, healthcare often represents the second largest operating expense after employee wages. And for most employers, it represents the fastest growing operating expense, one that they feel like they have little control in managing. And sound research and evidence have shown that worksite health promotion programs benefit both employees and employers. There's reduced sick leave, there's improved work performance and increased productivity, and decreased health insurance premiums as well. And since most employees work for small businesses, as you see, less than 1% of the companies have more than 250 workers. We really need to provide programs and opportunities for small business that may be less resourced, that may not already have a robust wellness program in place, and really give them the tools they need to be successful. Next slide. So Live Well at Work was launched in 2013 to collaborate with local San Diego businesses to build a culture of health and foster a healthier and happier, more productive workforce. The Live Well at Work initiative has supported hundreds of San Diego businesses, both small and large companies, develop and execute successful employee wellness programs. And at Live Well and Work, we envision a San Diego where every employer has the tools to develop a robust, cost-effective, and evidence-based wellness initiative. And we do this through a number of different programs and resources that we'll be talking about today to help overcome some of these common challenges and barriers that many work sites face. And we also have a little bit of a surprise today, because a program that we've been developing over the last 2 years just got approved, and today is our formal launch for that. So we're really excited to share the Healthy Workplace Accelerator program And we'll be talking about that in a little bit. Next slide. And so we've helped organizations in almost every sector, every industry, from hospitality to agriculture to tourism. Any type of business, large or small, can benefit from the resources and programs that we provide. Next slide.
Oops.
And we have a number of partners that we've worked with. One of them is here today, John, who we'll be hearing from the American Red Cross WIC. So we're really excited to hear from some actual participants and partners that we've been helping their organization move in the direction of wellness. Next slide. Slide.
Does it say our approach?
No, it still says some of our partners.
Does it work now?
No. Oh, there it goes. Perfect. Great. So our approach at the county for addressing worksite health promotion is less about the individual programs. We really take a 30,000-foot approach of looking at what are the policies, what are the systems, what's the environment that really shape a culture and create opportunities for wellness and smarter health decisions in the worksite. And so our approach is we always start with an assessment of the existing programs, policies, and environment to get a baseline of where an organization currently is in their process. And I help identify where the gaps might be, where some changes can be made. We engage organizations with various tools and resources and programs to help continuously iterate and improve and implement the program. And we have a lot of education and different posters and tools, things that you can very plug and play. Easy things that your organization can do to start implementing new policies and programs immediately. Next slide. And as I mentioned earlier, we really look from at a high level, what's the policy look like? Policies, what's the environment? What are the programs that really shape the organization? And so we help you craft new policies. We will give example of a lactation support policy that you can implement, right? So it's very wide in terms of everything from physical activity to nutrition to smoking cessation. There's a wide variety of areas of wellness that we provide support on that all fit under the categories of policy, environment, and programs as well. Next slide.
Okay, so I wanted to share some of the key strategies under Live Well San Diego. And before I do that, I really want to acknowledge our amazing partners. We could not have done this without the support of the University of California, San Diego Center for Community Health. We had amazing partners who've implemented Live Well at Work over the last 10 years. And so these strategies were developed by that fantastic team, Blanca, Rachel, Kelly, Aaron, over at UCSD. So we just want to give them kudos for the work that they did. We had a series of grants. Unfortunately, some of those grants are no longer available. And that's the reason why we're sharing some of the free and low cost programs that we've now developed. You'll hear from Spencer, but we were able to integrate a lot of these strategies, and you'll be seeing how and have these resources. Many of these are free and low cost. So let's start with the first strategy, Meet Well. This is really about how do we support an organization in your daily workplace. How do you host healthier meetings, events? A little bit later, we'll give you an example of a healthy stretch break. And then one of the tools that that we can share with you is the Healthy Meeting Pledge. And this can be customized. So whether you want to talk about the healthier foods that you provide at your meetings, addressing food safety. If you, I know that a lot of this was pre-COVID when we were hosting meetings that were, we had, food out and food safety was an issue. How do you reduce waste? How do you promote activity? So stretch breaks, walking meetings. And then also we have even opportunities to promote tobacco-free environments. And so all of these can be customized at your work site. The next one is Stepwell. What's great about an elevator campaign is to promote stairwell use. If your building has elevators, a low-cost project is to use the posters that we have available. We have emails to share with your team about how to promote the use of stairwells. And these are posters that you can put at the elevator. And then also along each flight of stairs, there are encouragement signs to let people know that they're doing a great job and how many calories they've burned. So all of this is available for free. Just let us know and we can make these available to you. And then of course, if you don't have stairs, you can still, just an example of some of our posters. And then if you don't have multi-story buildings, you can still have walking programs. So whether there's a walking path that you develop around your work site or your campus, promote walking meetings. We've also worked with the Del Mar Fair there you go, to promote a 10,000 step challenge in 2018. And so what was great about a lot of these programs is that not only do you support your employees, but you also support your customers. And I think that's something that you'll hear a little bit about the American Red Cross WIC, is that this is something that becomes a culture of health at your location. So now some place where, the county fair is outdoors, there's a lot of walking, people can be encouraged to follow some of these paths and really get their steps in. Another campaign that we promote is healthy nutrition through Eat Well. So whether you can promote healthy cafeterias or you can support healthier vending, we can even support having a break room makeover. I believe it was the city attorney's office. I'm so sorry, I keep on going backwards. The city attorney's office with the city of San Diego had a complete makeover of their break room, and a lot of the employees really got excited about having healthier snacks available for those really long days. And so again, we have free posters to not only talk about nutrition, but even to eat local. So there's a lot of great ways to focus on healthier options. So not only do we have posters, but there's also those smaller table tents that you could put in the cafeteria tables. And I don't know if you've noticed, but a lot of these are in the Live Well colors of the blue, orange, and green. So you're promoting Live Well San Diego at the same time. Okay. Another campaign is Drink Well, so promoting drinking water. It's always better to have low calorie options, low sugar options. So whether that's adding hydration stations to different areas of your work site, the California Department of Public Health has a Rethink Your Drink education campaign that is also not only for adults, but there's also materials for children. So that's something that your employees can also bring home and promote a lot of these lessons at home. So we have this concept of bringing wellness home. So whatever you learn and you practice at the workplace, you can also promote among multi-generational influence and impact at the home as well. And then, as Spencer mentioned, one of the policies that promote healthier families is lactation policies. So Nourish Well is the name of our lactation support program. And there are lactation accommodation policies. We can connect your team to support programs. And we partner with the San Diego Breastfeeding Coalition, and they can come to your site and help you with lactation room design. And so there's a lot of great resources that are either free or low cost. And not only does this support healthier families, but this builds morale at your workplace. One of the awardees a few years ago from the San Diego Breastfeeding Coalition is Milano and Company, which was an agricultural company in North County. And they actually helped bring some of their workers from the field with a truck during their breaks to the administrative offices to help them with their lactation breaks. And then they would bring them back to the field, to their work site. And these employees were just blown away by that level of support. So you can really see how it not only promotes a healthier lifestyle, but also your employees feel that support and that encouragement. And again, there's also promoting, lactation and that's healthier for the mom and the baby as well. So now let us have we're trying to practice what we preach. So we're having a healthy meeting break. We're about 20 minutes into our meeting. So usually we wait a little bit longer, but one of the practices that I wanted to share with all of you is called 4-7-8 breathing. This is, I'll just describe it first. It's breathing in for a count of 4, holding it for a count of 7, and then exhaling for a count of 8. And really what that does is slowing down your breathing. You can close your eyes and it helps you relax and just getting that really big, full, deep breath. And so one of the ways that we do this with children is you say, smell the flowers and blow out the candles. So whatever makes it easier for you, if you can just close your eyes if you want to. And let's take a big breath in. 1, 2, first of all, let's exhale. Sorry about that. Take an exhale, get it all out. Breathe in 1, 2, 3, 4. Let's hold. 2, 3, 4, 5, 6, 7. And exhale. 2, 3, 4, 5, 6, 7, 8. So now I won't count, but take a big breath in. Big deep breath in and hold it. Now exhale fully. So again, smell the flowers. Take a deep breath in. Smell the roses. Hold it. And now blow out the candles. One more time. Smell the flowers, breathe in. Hold it. And then blow out the candles. This is also something that you can do at night if you're having trouble sleeping. Sometimes there's a lot of things that rush around your head. So this is something that you can take a break anytime and just take a few deep breaths. So I hope you guys enjoyed that. All right, so now we have an interactive poll, and pull out your, where are they? Pull out your phones and you can either scan. Can you guys see it? Is it showing on the screen?
It is.
So scan the QR code, or if you prefer, you can go to the website slido.com and you can join by entering our number. And so our first question, the number is 333-111. And our first question for all of you is at your work site, do you have any of the following? And you can select more than one. Do you have wellness champions, wellness committee, a wellness coordinator, whether they're paid or volunteer, or none of the above? And so I'm going to stop share so I can see our results. Let me see if this works. Trying to share my screen again. All right. So people are still voting. Right now we have 67% that say none of the above. 33% they have a wellness committee. 33%, oh, it's moving around, have a wellness champion, and 30% have a wellness coordinator. So it looks like people are still voting. Okay, so none of the above is actually getting a little bit lower, but what's really fantastic about our approach is that wherever you are, if you've never thought of implementing employee wellness, or if this is something that you've been doing for a very long time, when Spencer shows you our new program, you can really see that it's customizable and it really meets you where you're at. So yeah, it looks like we're right at 50% now that don't have any of the above, and beautifully, perfectly, 1/3, 1/3, 1/3 have either a wellness champion, wellness committee, or a wellness coordinator. Okay. All right, well, I'm actually delighted that that worked out. Okay, so let me share my screen again. Because you never know with technology how they pan out. So a little bit later on, we'll show you the Live Well San Diego website with where you can find a lot of our toolkits and our programs. But these resources are all free, so please take advantage of them. We have the Live Well at Work Small Business Toolkit. We have that in a PDF form. A while ago, we had them in hard copy. We may still have a few copies for people. You'll hear a little bit more from Spencer regarding our Healthy Workplace Accelerator program. And then another resource is the Diabetes Prevention Program, and we have an employer toolkit. And that's really being able to work with your insurance company, or if someone has is on Medicare or on or if there's someone in the on Medi-Cal, it's all free. So there's a toolkit that really walks you through whether you are your employees have access to the diabetes prevention program. And San Diego has really done a lot to look at how to prevent the onset of prediabetes into diabetes. And so we would really hope that you can take advantage of some of these programs. Spencer?
Great. Thanks. Yeah, so the history of the Healthy Workplace Accelerator program, sort of the idea behind it was that Live Well at Work used to provide in-person, on-site technical assistance. We would go to an organization and coach them and have a meeting and do an assessment and be there to help them implement their design and implement their program. However, we wanted to be able to reach more organizations. We wanted to scale this work, and especially with everything going online, we thought, what if we could digitize our consulting, our technical assistance that we used to do? So that's the idea behind it. And so we've successfully developed this program. It's an online program that coaches you in a step-by-step way at your own pace through the process of taking the assessment, getting recognized for all the good work you've already done. It gives you a customized action plan, so you know exactly what steps you want to take to make some real changes at your organization. And it also creates opportunities for collaboration. So that's something that we heard a lot about from our participants, is that sometimes there may be one person involved in trying to create a healthier work environment, and that can be a bit lonely. They don't know who to talk to, what to do. And so we wanted to create a network of other organizations that are kind of in the same boat, that are also looking to meet with each other, develop new contacts, share best practices, talk about challenges, really support each other in sometimes a really daunting situation of how do I make a population health level change at my organization. So you can do next slide. And after talking with organization after organization, either an HR representative or a CEO of a company, we often heard the same themes, right? We don't have the time, we don't have the money, we don't have the staffing to really focus on this. We're so busy. And while all these reasons may be true, there's a lot that you can still do. And so that's what we do at Live Well at Work, is provide either free or low cost solutions that can make a big impact at an organization. For example, I can think of one organization that said that, their CEO was all in. They said, I want to do better. I want our employees to be healthier, to have access to healthier foods, to take exercise. He wants to do it all. But then management didn't really know how to implement that, right? They just got busy with their day-to-day tasks, and things would just go on the back burner. Other organizations said the opposite, that the employees and the managers and management did want to do more in terms of workplace wellness, but they needed buy-in from leadership. So wherever you are in your process, and whether you have a robust program already in place or whether you're just getting started, the Healthy Workplace Accelerator program will help take you to the next level. So now we're going to do a demo. Amelia, you can stop sharing the screen. And like I mentioned earlier, this is very exciting because this is a brand new program. Everyone here is the first to see it in its official state. So we're really excited to show it with you. I'm pulling it up right now. Yeah. Great. So can you see it? Yes. Great. So as I mentioned earlier, it's a 4-step cyclical process. The first step being score, the second step getting recognized for your wellness efforts. The third step is about taking action with a customized, personalized action plan, which includes step-by-step guidance and example resources. And the last step being collaborate. So as an organization, to get started, you would click the first step, which is score. And that would take you to the healthy workplace assessment, the safe, and the thriving. As you remember earlier in the presentation, healthy, safe, and thriving is sort of our theme for Live Well San Diego. And you can get started with any of these assessments. It'll take you to a survey, and then it'll populate this whole sheet. So I'll give you an example of some sample data. And this sample organization happened to score the exact same on healthy and safe. But you can see a complete overview of their wellness program. So this sample organization is doing really well in terms of strategies to improve nutrition, but they're a little bit weak on the maternal health and the alcohol and substance abuse and the tobacco cessation and organizational support. So after seeing this, a lot of organizations say, oh, wow, I really know now where to focus my efforts. And this is not intended to be a one-time assessment and a one-time recommendation. It's designed to be ongoing. So every 6 months, you'll have the opportunity to retake the assessment. For example, it says 96 days left before you can retake it, and it'll open up then. And when you retake it, you can see how your assessments have improved. Hopefully they have, because we want to see that upward trajectory and to be improving overall and iterating on your program. The next step in the process is getting recognized. So after taking the assessment, these will automatically populate. These are all the strategies that an organization is already doing well at. So, and you can click on them, but I'll show you that in a second. And it also gives you awards you a badge. So it averages and calculates the scores across the 3 assessments and awards you a badge. There's 4 different badges: learner, innovator, leader, and influencer, with influencer being the highest level. So this organization is just getting started because they're a learner, and it tells you exactly what that means. But as you retake the assessment, you'll be able to get a higher level badge. And this is something that once you're awarded a badge, you can post it online through social media, and we'll also mail you a physical decal that you can place at your work site to show your employees, your customers, your community that wellness is something that you value and that you're taking action in. And the next step is to take action. So all of these strategies are ones that have been recommended to an organization because these are where the gaps are. So you can see some examples from organized physical activity, like having a fitness class, to promoting water consumption, to providing injury prevention education or reporting hazards, as well as developing your vision for your wellness program, understanding budget and funding. So there's a lot of examples, and these are pulling from a database of well over 50 different strategies that we recommend. And then you basically just click each one to choose which one you want to focus on. So for example, I'd like to focus on physical activity and to keep track of that. And when you click on any of these strategies, it pulls up and gives you a lot more information for each one. So, for organized physical activity, as an example, you can learn why it matters. You can see a step-by-step process for implementing that strategy. We really try to make it as easy as possible. We provide a number of helpful resources like sample policies that you can click on, workplace physical activity break guides, all these different things to make it really plug and play for you. And it also serves as a task management tool as well. So, I've already gone here and put in some sample data, but you can check off as you go so you can keep track of where you are in the process, assign a task owner, do a start date and end date, and that helps track you where you are. And of course it says in progress because that one's in progress. And so that's that customized action plan. And every time you retake the assessment, this will refresh as well. And you'll get new strategies based off of where you are in the process. And the last step in the program is about collaborating. And we do that a few different ways. One is through our monthly networking calls, where we have a speaker, a subject matter expert, talk about different ways to promote physical activity or nutrition, different resources. And so it's a great way to learn how to improve your program. We also hear from a number of other organizations from their wellness coordinator. They often present about their program and what's worked and what hasn't worked for them. So it's a really great meeting that happens once a month. We'll share that as well for anyone on this call to join those as well. And we also have been curating a directory of community wellness providers. So these are organizations in the community that provide services that are either free or low cost to organizations. So an example may be the Center for Mindfulness at UCSD, and they can provide stress reduction classes. So that's just one example of some of our partners there. And that is a little, that's the demo. So we're really excited to share this, and we'll have an email at the end that you can email us if you're interested in participating in the Healthy Workplace Accelerator program, or even if you just want to attend some of those meetings and get started. And Amelia, I see your hand is up. Oh, all good. So I'm going to stop sharing my screen for a second. And Amelia, did you have anything else you wanted to add there, or should we jump right into the Q&A?
I think I had one interactive poll first before the Q&A, and I think this will also help us kind of guide some of the responses that John may have. So let me go ahead and share. We have one more poll. So the question there, can everyone see that? Is it showing up? Okay.
Yes.
So again, use your phone or type into slido.com, the same number. Tell us your most significant challenge or barrier to implementing worksite wellness. And then maybe keep it 4 words or less. And you can actually enter more than one challenge or barrier. So go ahead and enter that into your poll now. And so let me go ahead and see what the results are. Okay, so we have a word cloud, and it looks like the challenges that we're seeing, is that showing up on your screen?
Mm-hmm.
Implementation, support from leadership, time and manpower, boundaries, staff engagement is a big one, funding is a big one, resistance to change. And then I think I saw something about remote work and varying schedules among staff. So what we're hearing is that there are real barriers, real challenges to trying to implement some of these programs. Again, working from home and leadership support definitely comes in. So before we go into John's portion, Spencer, did you mention the part about how the Healthy Workplace Accelerator program can be used for leadership support? Did you want to go ahead and talk a little bit about that as a tool?
Yes, of course. So that's something that organizations have actually told us has been a plus, a benefit of using the accelerator program, was that a lot of time leadership, they may be for the idea of healthier employees, right? That's most people are. It benefits both the bottom line and makes people more productive and happier. But when it comes to leadership buy-in, part of that is showing the CEO or whoever the decision maker is that you have a real plan, right? This is not just some fun programs, but this is an evidence-based tool. This is our asset, but by giving a sort of your business pitch to him or her and say, we've taken an evidence-based assessment through the CDC. These are our results. These are our gaps. These are the strategies we plan to do. These are the step-by-step plan we have. It's going to cost this amount of money. It's going to take this number of meetings. And by having that plan is when leadership is going to really say, okay, that this all makes sense. I support it and would love to make it happen once you have that. So by taking the assessment, we've built you a business plan that you can pitch for internal stakeholder support.
Great. And then there's a few questions that are showing up. Thank you, Diane, for copying and pasting some of these questions. We will have our emails available at the end, but definitely reach out to Spencer or myself if you have any questions. And then we'll also be providing the link to our website. So to learn more about the diabetes prevention program, I'll actually provide a couple of links to the county's website to learn more about that resource. So without further ado, we are so excited to have one of our champions, our innovators, John Haubenstricker. So
great. So oh, you're on mute, John.
Hopefully.
Oh, there it goes. There it goes. Great. So, so John, do you want to just reintroduce yourself again in case people join late?
Sure. Yeah, I can definitely do that.
And what your role is at American Red Cross. Yeah.
Right. Definitely. Yeah. I'm the wellness coordinator for the American Red Cross WIC program. So I've been leading our staff wellness program now for the good part of 4 or 5 years now. So with the help of Live Well at Work.
Great. So how has the Accelerator program helped your organization, or how do you expect it to help in the future?
Yeah, that's a great question. The big thing, kind of like you kind of alluded to, was to be data driven, right? So we have the data from the assessments that you take on there, and that really helps lay the groundwork in terms of what's working and what needs to be improved. So we can kind of go back and see that improvement over time, and it also helps to share that with leadership. And currently, I haven't told you guys this yet, but it was shared with the California WIC Association, which is the advocacy wing for WIC at kind of more of a government level. And they just recently shared our results as an influencer with the whole entire state of California. So it goes out in the WIC Watch newsletter that's sent out to all the agencies. So leadership and also for our organization as well. So I mean, that's one of the big reasons why we do this. Plus finding resources there. There's, as you mentioned, there's so many resources you guys have culled over a number of years, and so that's really helpful too. And then the meetings to join to collaborate with others, which has been really profound too, to help, just constantly having new ideas and people to talk to, particularly in this day and age where we're so isolated, right? So.
Great. And is there anything that you learned or found unexpected in the process?
Yeah, I didn't know we were such an influencer, so to speak. So that was kind of nice to find out we're doing a lot of the right things, like you're mentioning in the Accelerator program there. But one thing that was interesting, because we tend to be, I would say we're fairly physically active, but we kind of got some lower marks on that. So that's one area we were been working on, and now we're going to be this year and next year. We've been providing a lot of more opportunities for competitions around physical activity to get our folks up and moving. So.
Mm-hmm. Great. And what advice do you have for other organizations that are just getting started and don't really know where to start in terms of their wellness program? Like, what's your advice for an organization just starting out?
Yeah, I have a great question. I have a number of tips. I think that will probably be kind of some first steps. One, obviously, figure out who would be interested in supporting this agenda, so to speak, right? As you saw in the survey you guys sent out, having a wellness team is important, some type of champion. If you're lucky enough, like my organization, have a coordinator, that's kind of my role, but at least somebody who's a champion of it and finding that person. Maybe it's you, and then finding some folks you can kind of surround yourself with that are going to be good supporters. Once you have that in place, do the Accelerator program, take the assessment, try to see where you're at, and where you can make some improvements. So that way you have some direction in terms of what are your next steps. I think those are kind of the big things there that will help you also build your case for leadership support, because you're going to need definitely that top-down influence, because otherwise it's going to be a real uphill battle. So you got to get them involved, once you get that data to kind of show and make the case for wellness there. And then think ahead in terms of, okay, now that we have this and we have all this data and we're going to pitch it to the leadership, what are some small steps? Make them, manageable and practical. You don't have to, like, as I've heard the axiom go, eat the whole elephant at once, and obviously we know Rome wasn't built in a day. So take little small bites, things that you think you can make workable steps to, and then and we start small but slowly build over time. It isn't going to be something you just kind of run with and like, let's do this huge wellness, campaign and such. It may be something you want to just slowly bite off bit by bit.
Got it. That makes a lot of sense. So what are the biggest barriers that your organization faced when it started its worksite wellness program?
Yeah, I think honestly, it's a great question. A lot of the same ones that are coming up in the poll, really. Funding was a huge one. Time is a huge one. My organization is a nonprofit organization. The money is not meant to be, let's go and invest a ton into these other like extracurricular other activities. We really have to be serving our community, So with that being the case, we had to really come up with some ideas that would be helpful for, low cost wellness type activities and activities that you can do within the workday without taking away time to service our participants.
Got it. And so what are some of the strategies you've used to overcome some of these barriers? I know you just talked about that, but do you have some more specific examples of these strategies?
Definitely. So some low cost ones and ones that are really well received in our organization is we call it 10-minute wellness breaks. And this has kind of evolved since then. As you know, by law, if you work at least 6 hours or more, you have two 10-minute breaks. So what we've done is added additional 5 minutes onto each 10-minute break to give people a little more time to go walk or do a video or something wellness related, so they can kind of enhance their wellness that way. Not a lot of extra time, but a lot of extra value. Our folks really enjoy that, and we have, over 90% of our folks actually entertain the wellness breaks. They really enjoy that type of thing. Currently, another one that's really, really popular is being able to come to work in a more relaxed attire. So this can be, workout clothes that are work appropriate, maybe a little more dress casual if you can't go to that level of casual attire with workout clothes. But that allows people the opportunity to engage in more physical activities. Because if you're dressed up, like say in a suit or a really nice dress, that may be harder to kind of like, do I really want to go for a walk or do this and get sweaty or get dirty? So having that ability to like, oh, I'm dressed in a way that I can probably entertain the idea of doing more physically active type of activities throughout the day. I think that really helps well too. A few other things we do is we have a monthly wellness hour. So each month we give our teams at each of our offices, we have 6 offices in San Diego County, an hour to do wellness kind of together if they're there, or if they're not, then they can do something remotely on their own. We also have volunteers we bring in to help out with some of the wellness stuff too. So you may want to think of that. Students or other volunteers could help out with some of the programming or some of the other stuff. Like you did today, we have wellness breaks during our meetings. Just again, in showing our staff that this is the culture we want to set for them, and we kind of do that through example by doing those types of things throughout the day. Partnering with other folks, like you said, for low cost options to kind of bring in folks that would help, like say for instance, financial wellness. One of your partners is Home Perks, so we've brought them in before to give financial talks and different presentations and such, which have been really helpful for our folks. And one that really helps that people just seem to love too is allowing them to have plants in the office. You don't have to buy it for them, but they bring it in and makes their environment more healthy. Or you can do it at home as well. So either way. So those are just a few examples. I think that will resonate with folks that have low time and not a lot of budget to throw at wellness.
Mm-hmm. Yeah, those are all great examples, and thanks for sharing. And I know I saw in the word cloud earlier some questions around how do you do this remotely? And I know you just mentioned, well, the plants, for example, is something you could do remotely, but is there anything you've done to help promote wellness at home?
Definitely. Thanks for asking. Two things that come to mind is one, I personally run this remote wellness break. I actually did it today, this morning, where once a month I get everybody together because we're all remote at headquarters, and I lead an activity for them, and it gets a chance for people to get to know each other and whatnot. So it allows them to bond and connect with each other, which is, not as often as we would like nowadays. And it's, just for a half an hour that we do this for once a month. It's really easy, and it doesn't take a whole lot of work, honestly, to do that. The other thing that does take a little more work, but I do that because I'm a registered dietitian, is I do cooking demos, and people really like that because they get to see me, cooking in my home and doing these types of things. But if you don't have that type of those type of resources, that may be a little bit prohibitive. But that's one way that people come together and we do that sort of thing. So a couple options there.
I think we may have to have John do a cooking demo for one of our monthly networking meetings. So my wheels are spinning. Someone is raising their hand. And unfortunately, I can't access the feed loop, so I'm not seeing the chat that everyone else sees. We are actually on the Zoom side of this presentation. So I'm not sure, but we'll be sharing some slides with our email address, but let me just go ahead and show you where you can find some resources. I apologize that we can't see some of the questions that are in the chat box. So let me share our website. Okay, so you can go to livewellsd.org, and is this showing up, Spencer and
Yes,
John?
yes.
And you can either go to topics and then click Worksite Wellness, or there's a link there, or even if you Google Live Well at Work or Live Well San Diego, it'll pop up. And so on our website, there's a host of resources. So you have the diabetes prevention employer toolkit. We have the Meet Well Pledge and the Eat Well practices. I mentioned our Worksite Wellness toolkit. And the breastfeeding friendly environments, and then some other pages. It'll take you to diabetes prevention and also tobacco control as well. So really a great opportunity to just have free resources, but really what we'd love for you to do is to come join us at our monthly networking meetings. Test out the Healthy Workplace Accelerator program. It's free, and definitely let us know if you have any questions. So I don't have John's email address here, but maybe later on we can share that with the, I think if we can get your email addresses, we can share our slides with you and then put our contact information. So definitely reach out to myself, Amelia, or Spencer. We can add you to our mailing list to attend our monthly networking meetings. I believe they are the 4th Wednesdays at 10 o'clock, and they're all virtual, and we have a recurring Zoom meeting. These are hosted by UCSD Center for Community Health through the San Diego Childhood Obesity Initiative. So just a great way to link up with not only our program, but a whole array of other resources in San Diego. So definitely want to have you learn about other programs as well. So that is our presentation, and thank you so much to everyone. It was great to have a number of folks on the line. Unfortunately, we don't have
Yes, so a couple of questions came through on my end.
great.
I think this one's directed to John. Have you seen any impact on staff retention?
It's a great question. Actually, just this year, we instituted a new culture of health in our surveys that when we were kind of doing our needs assessment, so to speak, that we do annually. Kind of like Spencer mentioned, this is a reoccurring thing. It's not a one-time deal that you kind of survey your folks. And one of the questions we had on there is what keeps you here? And one of the options was our culture of health. And we found that almost 50% of our folks said that because of the culture of the health and the support we get through our wellness programming, that is one of the reasons why they stay with us. So in this day and age, as you know, when we hear about this great migration and people moving around from one job to the next, trying to land the best deal or reprioritize what's important in life. I think this is one of the features that really stood out to our organization, is why we continue to offer wellness and do this for our employees. So great question. Thank you.
Great. And there's a couple more questions about how have you seen any impact on staff retention, or sorry, how can I learn more about the diabetes prevention program and how can they get the posters? So please, as Amelia mentioned, please email us. Just drop us a quick note. It doesn't have to be too formal. Just say you're interested in the posters or any of the small business toolkit or the employer diabetes prevention program toolkit, or the networking meetings, or the Healthy Workplace Accelerator program. So we'll help you. Just reach out to us. That's our job. We're here to help the employers and community make changes and improvements to their work sites. So let's flash up the email addresses once again, just to make sure everyone has them.
So I just want to thank everyone for attending. We hope you felt inspired to take this back to your workplace, whether you have a small business or you're part of a larger organization. This can be done, and we're here to support you. So any other closing words from our other panelists?
Oh, I just wanted to throw up the slide again with our email addresses.
You know what? I forgot to hit share. Does that work now?
Yep, there it is.
Okay, thank you. And if you provided your email address when you registered, we can send the copy of the presentation to everyone who provided their email address. So we have 2 minutes. So John, Spencer, any other closing comments that you want to offer to our participants?
I think this is a good stopping points. We can give everyone their day back and do 2-minute stretch. So I think we should just close it out from here.
Thank you, everyone.
Thank you.
All right.